Yeah, so hard things are hard. And fortunately, as a neurologist, I don't have to sequencing. I just have to rely on really smart people to do it. So I can tell you that from what I understand, there is a lot of technological innovations through the sequencing and the long and then the phasing assay where we were looking for, is there one of these two SNPs present, and are they on the same allele as the CAG repeat? And they're actually far, far away from the CAG repeat. They're thousands of base pairs away. So I think the methodological advance that was taken to do this was quite impressive, and I think confirmed what we suspected, that about almost 2/3 of patients would have these SNPs, and that they would be present on the expanded allele. This is an amazing time to be involved in Huntington's research. There are so many different avenues to where we're trying to make Huntington's disease a chronic disease like diabetes. And it's going to likely take a multitude of different treatments to get there. But I think the treatment that seems to be furthest along in terms of testing in patients is this idea of antisense oligomers. So this is the idea that you're giving a patient an antisense oligomer, you're interrupting the transcription and translation process, so you're reducing the mutant Huntington protein. And the hypothesis is if you do that, you're going to have a clinically meaningful effect on the progression of Huntington's disease. So that's kind of where we are right now, with the most common or the closest to getting an answer for this question. So right now there's essentially there's one ASO that takes down both the mutant and the wild type. That's being currently tested in a really large global phase 3 study. Just amazing what the Huntington's community has been able to do in getting that study going. And then for this, what we're talking about now is we're talking about bringing the mutant Huntington selectively down. And so we needed to do this study to show that we could A, find these patients, and B, show that we could enroll them in a dose-finding safety and tolerability study that's being currently conducted by WAVE. So I think what we're hoping to do, and I think what WAVE's hoping to do now, is to find the best dose. So far, the good news is that there appears to be good safety and tolerability, and they're in the dose discovery phase, and then translate from that data into a large test for allele-specific knockdown in a larger phase study. So that's kind of where we are. That's where we've set the stage for this. And I think ultimately, for Huntington's disease, the fundamental question is it okay to knock down wild type, or is it not okay? And I think that issue is kind of really at the forefront of these questions for knocking down protein expression, and that's where the science is going to lead us to getting an answer, hopefully sooner than later.